we're facing a massive burnout epidemic.
Mm-hmm.
I mean, so much so that the Surgeon General recently came out with a report about the massive impact that burnout is having on our healthcare workforce. In our profession, in physical therapy specifically, if you look at the research, there's somewhere between, the range is pretty wide, somewhere between about 36 and 82% of our profession rates themselves as burnt out on any given day. So even if we take on average, let's say one of every two
Yeah,
physical therapists is
that's
burnt
still
out.
horrible.
And think about how the rippling impact that burnout has, right? First and foremost, it impacts the provider. We know from burnout research that burnout is an independent risk factor of coronary heart disease, right? It's correlated with higher levels of anxiety, headaches, suicidal ideation. It not only impacts them, it follows them home. About 80 or over 80% of providers say that burnout negatively impacts their home relationships. And then if you follow that line through, it actually affects organizations and the healthcare system at large. That report that I mentioned with the Surgeon General, they estimate that there's $4.6 billion in costs due to transition, specifically due to burnout.
Burnout. Wow.
And who does that impact fall on?
Patient.
The patients. We have to figure out ways in which we can empower our fellow physical therapists, our fellow healthcare providers with innovative models, with entrepreneurial mindset or
Mm-hmm.
entrepreneurial mindsets so that we can usher the industry forward. Because now more than ever, I think we have an opportunity to change what the physical therapy industry and landscape looks like for the next generation.
Being able to, again, focus on that in entrepreneurial models where you're not dictated by the rules of the insurance company. You're creating your own rules to treat the patient in front of you the way that they want to be treated. If you think about, like, even if you flip the script, I know we're healthcare providers, but we're also patients too, right? When we go look for our own doctors, how do we get attached to that doctor? We trust them. We think that doctor wants to help us. Like, that is the most important thing. And if our providers are burned out, like you're saying, they're worried about other things when they're in front of the patient. We're not going to be able to build that connection with that provider, and then the care is just going to decrease after that. I think we were talking a little bit before we hopped on here, but yes, burnout's real in PT, but it's also maybe probably the best time to also be a PT because you have all these other avenues, you have all these other options, you have all these other trailblazers of people that have proven that a model can work, and now you don't have to burn out and you can help your patients even more.
So I'm just so fired up to see what comes of the next
Yeah.
generation of these incredibly talented students and
Mm-hmm.
future professionals. They're smarter than I think I
Oh,
ever,
way smarter.
way smarter than
Yeah.
I ever was or could have been even at that age.
Yeah.
And getting back in, seeing them, it really proves it to me every day.